Hey y'all, I want to thank you for being here and welcome you back. If you've watched the introduction video, you've gotten a little bit more information above. If you haven't, we'll be getting into this in just a minute, but I'll cover it again. We have a lot of patients who have been referred to us, maybe coming in for things like sleep apnea or looking for an alternative to a PAP machine, or you might have a children who's dealing with ADHD, who struggles with bedwetting and sleeping through the night, or you might be here because because your spouse told you that you snore so bad, or you snore so bad that you got to sleep in another room and things like that. And by the end of this presentation, our goal is that you understand that a lot of these things, while they may present in very different ways, that there's a very common root cause to all of them. So we're going to go through this. If you're an adult with sleep apnea, it may seem weird that we're talking about children to start, but what we've learned is that most of the things that are going on with adults, like sleep apnea, very often had signs and symptoms when they were children. So there's a good chance that we will be describing things that you may have struggled with as a child. So moving forward, so what we've seen is that there is a silent crisis in America. Many of the conditions listed on the left side of the screen here are things that children are dealing with, like bedwetting, mouth breathing, chronic allergies, crooked teeth, dark circles, the swollen tonsils and adenoids, to name a few. And then many of the conditions on the right are actually things that adults are dealing with, things like depression, anxiety, obesity, diabetes, cancer. And what we've seen with the research is that 9 out of 10 people are suffering from one or more of these conditions. And so as we go forward in this presentation, we're going to focus a lot on the children and the reason for this epidemic, because it's not usually corrected in childhood. And when it's not corrected in childhood, it can stem and continue into adulthood. So we're going to show you a few images of some children. I'd like you to consider if you think that they look healthy. In the past, I would have thought that they look healthy, but now knowing everything that I know, there are a couple things that stand out to me and I'm going to show you. So this is Michael here on the left. You'll notice that Michael has a retrognathic chin, which gives him the appearance of being overweight, even though he may not be. This little girl here, has a dimpled chin and doesn't have symmetry throughout the face. And then our third child also has a doubled and dimpled chin, as well as dry lips and dark circles under his eyes. Let's look at a few more real quick. Our first girl here has dark circles under her eyes, a narrow and small chin. We've got dry and cracked lips, and she just looks very tired. You'll also notice that she's got the head tilt, which is her body's natural response to try and open her airway. If it's closed while she's upright, tilting it is allowing it to expand. Our second girl here, she has very dark circles under the eyes as well. She seems that she can't close her teeth or her mouth over her teeth. She's got a small chin, again, lack of symmetry, and if she were to turn sideways, that same retrograde chin that's coming back. And our third child here, she's got the dark circles, red blotchy skin, a lack of symmetry, and chapped lips as well. And what we notice in all these pictures, these three and our three before, starting with Michael, is that they all look tired. But this is what a lot of kids look like nowadays. In fact, this is what kind of normal has become and what it kind of looks like now. But why are we seeing so many children who look like this? So just like leaves on a tree, the visible symptoms that we can see are the ones we identified in the photo. The retrograde chin, the sleepiness, the head tilting to open the airway, things like that are just part of the picture. And we know that there's an underlying cause, that the underlying cause is a compromised airway. And there seems to be that a possible root cause coming from even there is things like soft food diets, a weak tongue, processed food, weak facial muscles, and low tongue posture, tongue thrust, and maybe even limited to no breastfeeding may be contributing to some of these things that are affecting the jaw, affecting the teeth, and affecting the compromised airway. So where does this come from? We know that it stems in childhood. We know that a lot of people are dealing with it, but where does it start? Why are we seeing so many kids that have crooked and crowded teeth, and 80% of children nowadays need orthodontic? This is what we really should be seeing. So notice that this is our perfect 5-year-old here. We've got a perfect U on the top and bottom, a nice arch that goes around. We've got adequate spacing between all the teeth. This allows that when these primary teeth fall out, the permanent teeth are going to come in and have more than enough room. And so this is what we want to see when we're looking at someone who's roughly 5 years old. But at this point, we're almost calling it an endangered species because we're not really seeing this anymore. We wonder, like, could it be large teeth? Is it something that children just have huge teeth? Or maybe is it something else going on? And so what we see is when through normal craniofacial growth patterns, we start at this small skull here. This is where we're starting out, and this is where the image is ending here. And so starting at 2 years old and going to 17-year-old, what we notice is that majority of the growth, as you can see here, majority of the growth is throughout the bottom 2/3 of the skull. The nose has a good amount of growing, but the upper and lower jaw takes up majority of the growth of your craniofacial growth. And so when it grows out, we have jaws that come down wider, they come down or they come forward and they come downward. And that's what we're looking for, to have adequate space for our teeth, adequate airway opening, everything like that. When the growth starts at about 2 years old, we've developed 55% of what we're going to. 4 years old, we're about 75% developed. And by the time we're 12 years old, as you can see, in males is 90% and females 95%. And so that growth is almost concluded by the time we're 12 years old. So why do we have so many children that are suffering from abnormal growth and development? We've seen research, like you can see here by Dr. Robert. He's an anthropologist. He's been doing research for 30 years, got a lot of books, 7 books, hundreds of articles. He's been doing fossil studies, animal testing, population studies, and twin studies. And so to get this answer, we're going to look at some of the anthropology and some of the research that he's done on the development of the human skull, looking at fossils and his population sites. So we're going to go through that real quick. So 400 years ago, when Dr. Robert was looking at the human skulls, he noticed that they had a bigger upper and lower jaw, and that there was room for 32 teeth, and you didn't really see any kind of crowding or crooked teeth. And obviously, we didn't have any orthodontists or dentists to make that happen. And versus today, we really only have room for most adults to have 28 teeth versus the 32 that we originally had. And a lot of them are crooked and crowded anyways, which is not good. So through the population studies, to take his research a little bit further, Dr. Robert also studied isolated populations, people that weren't exposed to things like processed food, baby formulas, things like that. And what he saw is that in these populations, they breastfed for a lot longer, and that may be contributing to it. They breastfed for 2 to 3 years, and that they ate a diet that was mostly comprised of harder, tougher foods like dried meat and root vegetables. And so in those populations, he saw that they have very low incidence of crowded and crooked teeth, and they had a lot of perfectly formed upper and lower. So looking further into Dr. Robert's research, what he found was that the dietary consistency and the toughness of the diets in these rural populations seem to contribute and promote good upper and lower jaw growth and proper bone growth and muscle growth and everything. And that when populations, typically after industrialization, were introduced to more soft diets, more processed food diets, that those areas and those populations had higher incidences of the malocclusion of the crooked teeth. And so the soft diet and the processed food diet seems to be an underlying cause of everything that's going on with the malocclusion, the crooked teeth, and the undeveloped jaws. So continuing his study, Dr. Robert looked at essentially when the processed foods and soft diets were introduced to a population, how long does it take to take effect? And what he saw was that 50% of the population after the first generation, after it is introduced, so the next set of children, the next generation, have malocclusion issues, have crooked teeth issues. Continuing forward, by the second generation, after the introduction of the soft food and the processed diet, 70% saw malocclusion, saw crooked teeth, and by the third generation, it was 85. So what do we recognize from this is that malocclusion, problems with teeth, and problem with crooked teeth and airway, constricted airways and underdeveloped jaws isn't an inherited issue. It seems to be an acquired issue. So, fun fact, it takes 27,000 years for a genetic mutation to express itself in 51% of the population, or over half. So how does this happen in one generation? It shows that it is an acquired problem, not an inherited problem. So many children that need braces, or many people think that their parents need braces, so they'll need braces, but that's not necessarily what's being told to us through the research. Is that the crowding and crooked teeth is not genetic, it's caused by something else. It's caused by cultural changes and diet changes. So what have we seen by Western culture and the Western cultural influence? Well, we no longer breastfeed as long as some of the more indigenous and rural populations. They're breastfeeding for 2 to 3 years, and in the US, because of work schedules, and we don't have the luxury of breastfeeding for that long. So most babies are breastfed for like 6 months before mom has to go back to work, or at the lowest amount, 6 weeks maybe. And at that point, we transition them to soft foods, bottles, and what we know is that when babies are using bottles to feed rather than being breastfed, the expression, how much effort it takes them to get milk out of the bottle is nowhere near what it takes when being breastfed. And so they're not using their facial muscles like they would be if they were breastfeeding. So it's not as hard to extract the milk. And so that kind of seems to contribute a little bit to what the jaw is being developed and having to work. So things like Gerber baby food, the finger foods that just melt in your mouth, yogurt, applesauce pouches. I mean, we've had all of these when I was growing up. We had all these things. I know this is in just about everyone's home, and we seem to give it to our babies out of convenience, but also because we're afraid that they'll choke, right? And that's something that everyone worries about. And so the way that it should be is, in a perfect world, we would be giving our kids vegetables, root vegetables, fruits, meats, foods that help all of our babies grow and develop in the lower 2/3 of their face like we saw before. So here's what we know is that most malocclusion is acquired, not inherited, and that malocclusion is unique to the Western culture in that the presentation of malocclusion is a key indicator of an underdeveloped airway. So we're going to transition here for just a second. We're going to talk about the importance of the tongue function and its posture. So in research that we saw from Dr. Wallace, he researched how soft food diets affected the development of the muscle of the tongue. And then in the development of the muscle of the tongue with weaker tongues, we saw that they can't necessarily drive the primary dentition out into a space relationship that we want and we're looking for in fully developed arches. So essentially, when tongues don't have the muscle that they need to, they're not helping spread out the teeth and spread out the arch the way that it should be, which leads to crowding of the permanent teeth once they start to come in. So we're going to look forward here, and this is a really good example that I like a lot. So the tongues essentially are like the scaffolding in your house, and the scaffolding in your house is akin to what our tongue is. It's scaffolding for our teeth, so it acts as a natural retainer. And so what happens when the scaffolding in the house crumbles? Well, the bricks start to move, and then everything starts to shift. And this is the same with the tongue. If the tongue doesn't work properly and it can't get to the roof of the mouth, what happens? The teeth move and shift. So if you can't have the tongue placed up here like it should be, all of this shifts in, shifts down where it shouldn't be. So having a strong tongue is really important. And as a good friend of my dad's once said, is that it's almost like having an orthodontist in your mouth. It helps retain the teeth where they should be. So here's another example. Here's when your tongue isn't strong and fully functioning, you end up with a V-shaped arch. We want this beautiful U arch. And so we get this V shape, almost like these Gothic arches, when the tongue isn't there to help balance out the teeth and push them out to where they should be, like I said, and then acting as a retainer once they're there. But when you have a strong and healthy tongue and one that functions correctly, you get this nice arch right here, and you get this U shape that keeps teeth out and allows them to not end up being crowded and crooked. And along with our tongue, let's talk a little bit about the maxilla. So a lot of people don't know that the upper jaw really does more than just house our teeth. It also acts as the area for our sinus cavity, and it holds up the lower orbits for the eyes. There are a couple doctors that once said that the dental expansion that goes along here. So let's talk about the maxilla. A lot of people don't realize that the maxilla doesn't just house our upper teeth. It actually does a lot more. It has our sinus cavity as well as it is the so looking at the maxilla, talking about this a little bit more, a lot of people don't realize that the upper jaw actually does more than just hold our teeth. It holds our sinus cavity as well as makes up the lower portion of the orbits for our eyes. Dr. Christian here, he stated that essentially the dental arch expansion that improves the sleep disordered breathing in patients with an upper and lower jaw construction is a valid treatment for those sleep disordered breathing problems with patients. So we're going to see here real quick. This is a better example. So demonstrating what our upper jaw looks like today. This is what we see in a lot of people, that V arch, high palate. Here's a modern day scan from the 1940s, as well as an actual modern one. And then look at these prehistoric ones. In the prehistoric scans, we see this beautiful U-shaped arch like we saw back in the earlier research. We know that the tongue is able to get up and forward into the palate and is working properly. But back here, the tongues aren't up there. They're not creating the arch in the palate that we need, and it's causing overcrowding and lots of other problems. Moving on from there, let's look a little bit about the functional airway. So this image shows us that the upper and lower jaw is a major portion, or accounts for a major part of our airway development. So you can see when an upper jaw is fully developed, it allows for more airway up here, more open airway. When it's underdeveloped, an upper jaw will keep closing on the airway, as well as when it's underdeveloped, it'll actually keep the lower jaw from coming out and fully developing, which then being trapped by the upper jaw and the upper teeth. This lower one not developing leads to constriction down here. So it's actually a double problem there. When the upper one doesn't develop as well, it constricts, but it also causes the lower one to not develop correctly, and that constricts as well. So when the lower jaw doesn't develop, it impacts the lower part of the airway as well. So what do we want an airway to look like? I mean, what does your airway look like? Does it look like a narrow straw and you're having a lot of problems sucking air through it? Or does it look like an open hose? And, thinking about this, what would you rather have, a wide garden hose or a narrow straw? So here's some images of a couple airways. So we're going to see right here, this is a severely constricted lower airway. You can see that they're not able to get air really past that point at all. This is a typical mouth breather, as we talked about, that mouth being open and back. Constricts down here as well. While it may be opening up, it constricts down in the lower areas of the airway. Here's an image from a child with Asperger's. You can see here this child has a lot of constriction in their airway and a lot of constriction around their jaw. And then here's one more of an adult with sleep apnea. And again, you can see while it may be open at the top, it's closing all the way down. You can see where that jaw is almost not pinching, but pushing on it and showing that this is where it's constricting on top of everything. So I'm going to play a video for you real quick. I want to watch you to watch the video, and this really ties together everything about what we just learned. I'm going to minimize myself for a moment, and I'll be back.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. Adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits. Children.
So I'm glad y'all were able to see that whole video. I think it really makes a difference and shows you how those changes affect our lives. I have one more for you real quick. This is going to be of our baby Eli here. We didn't make this video, but it was actually recorded by a mom, the mother of Eli, who's a nurse. And so I want to show you this because it's a really good demonstration of what a child looks like when they're struggling to breathe while sleeping. And so you'll notice here, when I start playing it, that he's sitting up. So imagine, like we looked at before, if he was sitting down, laying down, he's going to have even more constriction. It would be much worse if he's laying flat on his back. So I want you to pay attention to what his mom does here. I'm going to narrate a tiny bit for you, but so he just breathed in. You can see that it's a lot. It's really hard for him to breathe. You can see that it's, it's just taking a lot of effort. And look how red he is. He's holding his breath that whole time, still holding it, and then finally taking that air in. And you can just look how hard that is for him. And it's closed off. And this happens over and over for him. I mean, several seconds in between the breathing, which is just exasperated and hard for him, until he finally, there you go. And then he ends up holding his breath again because it's a constricted airway. So, I mean, this goes on the entire time. And in just a couple minutes, you can see this is, we're going for about a minute, and he has had that happen 3 different times so far. So you can see here, she brings his jaw forward a tiny bit and try not to wake him. But just watch what happens. Look at this just huge change. So she sticks her hand in a tiny bit and just pulls his jaw forward just the slightest bit. And you notice he's quiet. Look at the color leave because he's not trying so hard. It's not so hard on his body. It's breathing through his nose, like she just said. And he's actually got calm breathing, and he can sleep well. So look what a big difference it makes when his mom pulls the jaw forward a little bit and opens his airway. And it's a tremendous, magnificent difference. And he's going to be able to sleep good like that. But when she lets go, it's going to go back to having trouble breathing. So I just want to share that with y'all. And I appreciate you watching it. So we're going to move forward here. So what we've seen, there we go. So what we've seen is that this is a good image real quick of baby Eli, as you can see. So the development of the upper lower jaw, when it's back, it's constricting that airway. He's not able to breathe all the way through. You can see the constriction here, which is why he is having such a hard time breathing and taking those big gasping breaths, gulping breaths whenever he does end up breathing, because he's opening forward to open up his airway because he can't nose breathe beforehand. And when she pulls it forward and he's relaxed, you can see his complexion change, and you can see that he's able to breathe through his nose. So let's talk a little bit more about the importance of the nasal breathing for the mouth breathing, like we just saw with Eli. When you are nose breathing, like you should be, the air is warm, it's filtered, it's humidified. When you're breathing through your mouth, it's unfiltered, it's dry, it hits the back of your throat, which causes swollen and inflamed tonsils, and even adenoids, which can further impact your ability to breathe. And then in addition, most people don't know this, that there is nitric oxide that's produced in your sinuses, up in your nose, and it's a vasodilator. And so this helps your body absorb oxygen. So when you breathe through your mouth, the oxygen is not mixing with that nitric oxide, and so your body isn't absorbing the oxygen as efficiently as it would be if you were nasal breathing. So it's a huge part, nasal breathing is a huge part of our bodies, and it's very important to our overall health. Looking at a little bit of research here, talking about the importance of nasal breathing versus mouth breathing, we're going to look at this from Dr. Harvold. And so Dr. Harvold did airway studies on young monkeys. He wanted to demonstrate the impact of mouth breathing versus nasal breathing. And essentially what he did was he took monkeys that were nasal breathers, like they should be, and he put some cotton rolls in their nose to obstruct it and make them mouth breathers, which changed the tongue posture. You'll see a lower tongue posture and led to the malocclusion. So pull forward right here, you'll be able to see this a little better. So the pictures on the left are the monkey before their noses were blocked. And the pictures on the right are after they were blocked. So you'll see the difference here. Here, he's not obstructed, he's totally fine. And then you'll see the change right here once he is obstructed of that mouth change and the tongue posture. And then the obstruction over here, you can see the teeth difference and the tongue being out. And this was just a short difference of time. And so in the first picture, you've got that long, narrow face. Or after the first picture, you've got the long, narrow face, which is what we kind of call the melting face syndrome. The tongue is not in the roof of the mouth where it should be, as you can see right there. And looking at the after picture, the tongue is protruding and is changing the teeth alignment after just a short period of time. So here's what we know. We know that when you have a compromised nasal airway and you breathe through your mouth, it leads to low tongue posture. And that mouth breathing can cause the tonsils and adenoids to swell, which further impacts your ability to breathe. Research similar to Dr. Hovholtz, but from Dr. Linder Aronson, did a study on children, but he looked at children who are mouth breathers versus those who are nasal breathers. And he found that the nasal obstruction that leads to mouth breathing leads to the low tongue posture, and as we learned, higher rates of malocclusion. So it's just backing, and he's seeing the same thing that's going on with the monkey's experiment, but he's seeing the same thing when he blocks. You can see the cotton balls right here, but when he blocks it, that the mouth breathing leads to low tongue posture and then the malocclusion, which is not what we want to see. So what we want to do is help people be able to breathe better and breathe through their nose. It's really important that we get people breathing through their nose. So we talked in the beginning about ADD and how that's a condition that we're seeing in kids, and you might be wondering, how is all this connected? When you have a small child who's mouth breathing and has a small airway, it impacts the child is able to sleep. We know from research that sleep really, really matters for children, and you'll see in just a second about how it develops into all these other issues. And when you have proper sleep, your child is better, but we'll get into that. So when the child is mouth breathing and has a small airway, this will impact how they're sleeping, and this leads to rest, sleep, nighttime arousals. And when the child doesn't get a good night's sleep, it impacts their quality of life. So I'm having to watch another video real quick from Dr. Moralia. He's going to talk to us more about this, and I'll minimize myself again.
Now take a child, alter their quality of breathing and sleeping. And the real big issue now is, how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive, and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD, and our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to a so-called calm. But it doesn't make a better learning child. You're not going to have a child who's able to learn as well. So now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep-deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe that cause has to do with the quality of the breathing and the sleeping overnight. And there's a lot of research out there. And one of the pioneers here is Dr. Stephen Sheldon out of Lurie Children's Hospital in Chicago. And he does a wonderful job of researching, and over the decades, he's come to a conclusion, and I've seen him speak, and it's not soon after he jumps on stage and he makes a statement that ADHD and ADD do not exist. They are an outcome of a sleep disorder breathing. They're an outcome of a poor quality of sleep. It's all about the quality of sleep. Another researcher who's produced beautiful research on the same topic is Dr. Karen Bonnick out of Einstein at Yeshiva University. Dr. Karen Bonnick has the largest study to date. 11,000 children were watched over 7 years. And they were divided into two groups, sleep disorder breathing children and children who do not have sleep disorder breathing issues. The children in the sleep disorder breathing group, over their 7 years, her study showed that they were 50% more likely to be diagnosed with an ADD or ADHD diagnosis and treated with medication. 50% is a coin toss for our child to be diagnosed and treated with a medication. Also in her group, they were doing testing. They were doing IQ or intelligence testing along those 7 years. And the children with the sleep disorder breathing, their intelligence testing, their IQ scores were dropping over those 7 years. And that's really not the way it works when you're growing and forming. The formative growing years for a child, when they're sleeping and breathing well, your IQ raises to a certain point and then you kind of plateau. We don't see IQs diminishing amongst children.
Awesome. So y'all got to watch that. You got to understand what's going on. Dr. Morale is really great at explaining that. And so we're going to keep moving forward. So, as y'all saw in Dr. Morale's research, he referenced Dr. Bonnick several times. In her study, she studied 11,000 children over 6 years. In those 6 years, she saw the way the children were broken out. Those with sleep disordered breathing problems ended up with a lower diminished IQ over those 6 years, and the children that also had the sleep disordered breathing problems were at an increased risk for being diagnosed with ADHD and ADD by 50%. That's a huge increase overall. So you might be asking, like we've talked about before, how is this connected to bedwetting? So I'm going to let you watch another quick video from Dr. Moralia, and he'll speak a little bit more about that real quick.
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best kept secret. Not many people are running around and advertising that their child is bedwetting at the age of 5, 6, 7, 10, 14 years old. But bedwetting does have a relationship to how we're breathing and our quality of sleep. And some of the causes for bedwetting relate to the way oxygen is exchanged in our body. And the way I'll describe it is this. If we're breathing through our mouth, that air coming into the lung isn't really filtered, warmed, or humidified appropriately, and the body can't exchange it appropriately. So a little less oxygen goes to the brain. Now, the brain is a very sensitive organ. When the brain recognizes little changes in oxygen, it goes to work immediately. Because once the brain starts to recognize a little less oxygen, it doesn't know if we're being choked to death, a very serious condition, or if there's an imbalance in how we're breathing at night, but it does start to trigger a little bit of the fight or flight response. And a little bit of the fight or flight response means the brain's going to look at the body and say, all right, if we've got a little bit of an oxygen issue going on, I'm going to pull oxygen from something that it picks to be unnecessary right now and maybe deliver it somewhere that might be more important, planning on a rare occurrence as if the oxygen was going to stop. So if the brain's recognizing a little less oxygen, all of a sudden it's pulled from the urinary tract. If the body pulls a little oxygenation from the urinary tract, it might void. So we might wet the bed.
So, what can we do? It may not be what you think. I want you to meet Connor Deegans. This video was made by Connor's mom, and this is another powerful video on how the airway and sleep can impact a child. Let me play it for you. So you saw Connor's story and you learned a little bit more about what's going on and why this makes such a big difference. So what can we do and how are dentists helping? Dentists are playing a huge role in what's going on with children, and I'll show you a couple cases of kids that are being treated with the oral appliance therapy by dentists. This is Hunter. As you can see, he has a deep bite and he has no room for his permanent teeth to come in, and we know that that's a sign of underdeveloped upper and lower jaws. Just after 10 months in treatment, you can see the difference here. You can see he's less overcrowded and he's got his jaw coming forward in a better place than it should be. And actually, just after a week of treatment, he ended up stopping his bedwetting problems, which is a huge difference. Why? Because he was able to breathe and sleep better. Let's go forward to Paige. So this is Paige. She had a deep bite, just like Hunter did. And as you can see, after 10 months of treatment, that crowding has gone down a lot. She had a lot of crowding to begin with, and you can see the development of her upper and lower jaws. You can see here where they're back before, and then here where it's a lot more forward and deep as it should be. So that you see that defined jawline. And by moving her jaw and making it wider, moving it forward, her whole profile changed, and she got a beautiful result. And so it's a huge, remarkable transformation. And let's go back to Michael. You might remember Michael from the beginning of our presentation. You'll notice that Michael actually isn't overweight at all. He had that double chin because of his You might remember Michael from the beginning of our slides here, beginning of our presentation, and you'll see now, being able to see his treatment, that he wasn't overweight at all. He had that double chin from his jaw being receded too much, and the underdevelopment of his upper and lower jaw gave him that appearance. So this is Michael after the end of his treatment at 14 years old, which is awesome. And we're going to see here as well, here's the side profile, the one that we looked at before, where it's like, okay, he might be overweight, but look at this difference in just 5 years of all this treatment. So look at the difference, we'll pull forward here, look at the difference in Michael's teeth. Now he did go through some aligners at the end of the treatment to close some of the spacing, but still is a beautiful result and such a big difference. And then better than that, let's look at the changes in Michael's airway. So here's before. You can see right here, he has the small airway in the before scan, almost like the coffee straw that we looked at before. And then this is what we strive for, is look at the curvature after of his spine. It's straight. He's got his jaws coming forward and his spine is in alignment, and that open airway has made such a difference. When before he's got this closed, curved spine and his airway is closed off with the jaw, this straightening and this opening of his airway with his jaws coming forward is just beautiful. And it really helps having the spine in alignment as well. So, if only we had known. What about my child? What about my spouse? What about me? Well, I want you to meet Dr. Tara Griffin. So we're going to go through a transition here. Dr. Tara Griffin, she's a dentist out of Florida, and she was her own patient using this Vivo system, the one that we're using. So you'll notice before she's got a gummy smile, and it's changed from before and after. I'm going to let you hear from her as she talks about her treatment and how it seemed to have transformed her life and then her practice.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, you know? And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos appliance. As soon as I started treatment with the Vivos appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos appliance is worn in the early evening and while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs, and we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos appliance, if this would be good for you, then I recommend you coming into a Vivos center to be evaluated to determine if this is something that could help you.
So here's another look. What I want you to notice here is the long, narrow face, the lack of symmetry. But as we go through her transformation, as she goes through her treatment, you're going to see this big transformation in not only how she, as you can tell, of her overall health, but her change in her physical appearance. I mean, she looks younger, and she has doesn't have the dark bags under her eyes anymore, and you can just tell that she looks like a happier and healthier person, which is such a big deal. It's awesome to see these outcomes. Here's another one. We want to talk about Christy. This is actually a testimonial for Christy. She came in for cosmetic reasons. You can see she kind of has a gummy smile, and she didn't like that. She wanted to see if there was something that could be done for her. And so looking at her before and after, you can see the changes that were achieved. You can look at the before and after of her profile here, and you can notice that the growth and development has actually brought her jaw forward to be symmetrical with the rest of her face, which is just a huge deal. So Christy, she actually left a couple testimonials for all. So she said when she's smiling, she notices that she's physically unable to smile as big as she used to, but that her gums are barely showing. And so it feels different when she smiles, and she doesn't know how to explain it, but it's awesome. When she speaks and when she eats, her jaw's not popping anymore. She can speak more clearly, and really she just notices there's a different amount of room for her tongue. And so being able to breathe well through her nose has made all the difference. And she was super happy, and we're glad to see happy patients. So our goal around the entire Vivos system is to expand the dental arches. We want to promote healthy nasal breathing like we've talked about. We want to eliminate mouth breathing for multiple health reasons. But the nasal breathing, like we said, we want it to be able to filter the air, warm and moisturize it for optimal consumption in our lungs and optimal oxygenation in our lungs. We want to be able to train the tongue. We want to strengthen and condition the tongue and help reposition the tongue up and forward to help promote proper swallowing and speech. And then we want to eliminate bad habits, the thumb sucking, the tongue thrust, and the reverse swallowing. These are all things that we want to be able to work on and are able to work on with our Vivos system and expanding the arches. So how are we going to do this? Well, the Vivos system has a couple key components. So how are we going to do this? Well, the Vivos system has a couple key components that are made up of the screening, the medical imaging and diagnostics. We also take CT scans to see the airway and the intraoral and extraoral photos, as well as an intraoral scan to see the occlusion. And then we also incorporate a home sleep test. And this is a great tool not only for diagnosing, but also in case acceptance and helping build a comprehensive treatment plan. We can see the before and afters of how sleep changes. So we take a personalized interdisciplinary treatment approach. This is an individual approach, and our appliances are specific per patient. Yours is different than anyone else, and we work to make a treatment that fits just for you. So of course, this is oral appliance therapy. The Vivos system is for kids and adults. We have the DNA, and that can be used for the upper and lower, and then the mRNA, which is the same as the DNA, but the mRNA has a mandibular advancement component, so it actually pulls the lower jaw forward to open the airway as well. But with that, we use our Vivos guide, and that opens up the system for children as early as 2 years old on up to 12, or once the permanent's in. We have a little bit of a change there. Once the permanent's are in, then we can start treatment as well in children and adults that have a permanent teeth. So we take, along with our interdisciplinary approach, we take an integrative approach. We need to incorporate the expert potentially of ENTs, chiropractic, orthodontists, maybe myofunctional therapists to treat our patients in conjunction, because this is a multidisciplinary approach in some cases. This may be something that your dentist is treating, that we are treating in the office here, but we may need to talk with an ENT about the changes that are going to be made in the airway passage. You may talk with your chiropractor about that spinal alignment, because you're going to see good changes, but you're going to see changes. As well as with the orthodontist about potentially closing any gaps at the very end once we have that palate expanded the way we want it to be. So we want to talk a little bit more about the patient treatment technology and the breathing wellness movement. So I've got one last video for y'all. So I want to thank you for watching everything. We're excited to talk with you and see you. We're going to play this last video, and we hope to see you in the office soon. Thank y'all.
I really feel like Vivos is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well.
If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with two fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those two modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life.
The interesting thing about CPAP and oral appliances is, although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time.
Along comes Vivos and says, wait a minute, we have a better option that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols, and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
Vivos is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, is her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my Vivos device.
My asthma has gotten much, much better. Without the Vivos, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile, and I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down, he's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this, and I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself because now the body can breathe and sleep well. That's exciting.
I just want to thank y'all again for being here. We appreciate you taking the time. We are here to talk to anyone that would like to. We want to be able to help you breathe better, sleep better, and feel better overall, whether that's for you, your spouse, your kiddo. But give us a call. All of our information is below, and come in and let's get you taken care of. Thank y'all.